Hi, everyone. Welcome to Let's Keep Moving with the American Parkinson's Disease Association. We're so excited that you joined us today and really happy to talk about our topic, which is frequently asked questions from people with Parkinson's about physical therapy. So we got a lot of questions ahead of time. Thank you so much if you submitted in advance. We'll also be taking live questions that we'll answer at the end of the session. So if you have a question that comes up, you're welcome to put it in the chat and we'll do our best to answer what we can at the end. My name's Sarah Zoller. I'm a physical therapist. I'm here at Boston University's Center for Neurorehabilitation, which is also APDA's National Rehab Resource Center for people with Parkinson's. And I'm joined today by my colleague, Teresa Baker, who's also a physical therapist here at Boston University. And she's going to lead us off with some information about questions that we get all the time in our role here as physical therapists. So take it away, Teresa.
Thank you so much, Sarah. I appreciate that. Hello, everyone. Welcome back. We're so pleased to have you here on Let's Keep Moving. My name is Teresa Baker, and I'm another physical therapist at the Boston University Center for Neurorehab. And as you can see here, our topic today is frequently asked questions that we get about physical therapy from people with Parkinson's and their families. Um, so this is our team at Boston University. We are a group of researchers and physical therapists. We have a clinical practice and a research practice. And our goal really is to optimize rehabilitation for people with Parkinson's. And we're so pleased to share what we have to offer here in the broadcast. And by way of disclaimer, this presentation is for general information and should not be considered individual medical advice. So we do ask you to check with your physical therapist or your physician for information that's right for you. And so we get a lot of questions about physical therapy from people who are coming to us for physical therapy or don't know as that much about it. So that's our goal today, is to answer some of these common questions. But on that note, what I wonder is if you have other questions that come up in the broadcast or just things that are on your mind about the topic today, could you enter that into the chat? And then what we'll do at the end of the presentation is come back together and Sarah will join us and we'll try to go through questions from the audience and get to as many as we can. So what sometimes people ask us is, what is physical therapy for people with Parkinson's? That's a big question of what we get. What does it look like? What's involved? And to that end, I would start with, say, the goal in mind of physical therapy is to really help people move safely, confidently, independently, and do the things that they want to do. And that's the overarching goal of physical therapy for people with Parkinson's. So then the question is, okay, well, then how do we get there? So physical therapy will start with an examination, and we're looking at a number of different things. All of it is personalized to the individual in front of us, but for the most part, we're looking at how someone is moving. And by that, we very often mean how someone is walking, what their speed is, what their endurance is, what their quality of their walking pattern is, what challenges they may have with walking. We look a lot at balance, so we can kind of examine all different aspects of balance. We look at somebody's posture. We look to see kind of what challenges they are having in their day-to-day life. We're looking at strength, looking at their range of motion. We're also looking at sort of the common aspects of Parkinson and how it may affect someone's strength, maybe affecting their slowness, their stiffness. So there's a lot of different components that go into an examination in physical therapy, which is the first meeting with a physical therapist. But then really the goal is for a physical therapist taking in all that information and taking in sort of the discussion with the person in front of them to prescribe a program. And by that, I mean something that is based on the data that we collect on the examination, very specifically tailored to the needs of the person. It will definitely include optimal exercise recommendations, and I'll come to that a little bit later on what we might mean. But physical therapy is not only just recommending exercise. Often there's treatment beyond exercise. And for people with Parkinson, what that often includes is specific walking practice training, very specific balance training, especially in context of regular activities. And it can also be strategies for movement in other daily activities. For example, being able to get up from a chair safely, being able to roll in bed safely, being able to get in and out of the car safely. So there's a lot that can go into a physical therapy program. But again, it's based on collecting data and discussion with the person in front of us. And then another question that comes to us very frequently is, well, when should someone with Parkinson's start physical therapy? And our major answer to that is early and regularly. Excuse me. And by early, what we really mean is as soon as possible upon diagnosis. And that's not to say that if someone has been diagnosed with Parkinson and physical therapy didn't start right away, that that's wrong or that's a problem. But what we strongly advocate for is physical therapy to work with a person diagnosed as early as possible, even before someone might expect that there's an issue or that there's a problem with their movement or their walking. Um, we also recommend physical therapy if something is changing, say balance is getting more difficult, don't notice a change in your walking, or that things are becoming a little more difficult in terms of how you're moving around at home. This idea that physical therapy should be a regular practice for someone with Parkinson's. You might even consider checking in yearly with your physical therapist on the idea uh, of how someone is checking in with their neurologist. It's something that you do annually or more than once a year. So that's really what we advocate for in physical therapy. And I'll just show you what I mean by an example of a model of care of physical therapy. And this model was kind of developed by our director, Dr. Ellis. We call it the secondary prevention model of care. What I mean by that is trying to use physical therapy to kind of support someone's health and their ability to participate before something else happens that might limit their mobility. So our suggestion in this model of care, you can see kind of at the left-hand side, say hypothetically someone is diagnosed with Parkinson's, our suggestion is that there's an immediate referral to physical therapy so that and that examination can happen. We can collect information and collect some data on how someone's moving, and that can almost serve as kind of a baseline measure. At that time, when someone's referred to physical therapy, again, they'll work together with their physical therapist to establish a program, including exercise, of what's right for them. And there'll often be a number of visits working together to develop that program, to make it realistic, to make it sure that it's working for the person. And then usually what happens is that that round of physical therapy will come to a discharge, it'll come to an end. And then in the meantime, say between potentially episodes of physical therapy, the goal would be, could a person continue with their exercise program developed with their physical therapist? Could they keep up with exercise and activity in other ways? For example, sometimes people really enjoy community-based exercise programs, say a class or something at a local fitness center. What kind of things will keep someone motivated to participate with exercise and activity in the long term? And then what might happen, say, in this example, say 6 months go by and it's time to check back in with the physical therapist. So that would be coming back to physical therapy, a new examination, and then maybe look at the program and decide, is that still working? Is something needing to change? Is everything seemingly on track? If so, that's excellent. Maybe that sort of a new evaluation is 1 or 2 sessions to almost tune up the program, and then to end that episode of care, and then continue the exercise and activity practices that help the person stay engaged, and then again follow up with physical therapy, in another 6 months. So we can kind of work together with a person over the course of time with episodes of physical therapy. But all the while, that's helping us keep track of their information, keep track of their function to see how they're doing. And that's the kind of thing that might help us pick up on changes that are happening before there's an event or a fall or some other issue that's a little bit of more of a disruption to someone's life and their movement. So this is just one idea of a model of care of how physical therapy could look, say, over the course of someone's continuing journey with Parkinson's. Um, but if I had to say, of all the questions that I think we get the most in our center from people with Parkinson's and their family, this question: what is the best exercise for Parkinson's? Some people will say, just tell us what the best exercise is, and I will do it. And as it turns out, the answer to this is not so simple. There's no one single best exercise for Parkinson's. Um, the developing an exercise plan and program for someone with Parkinson's does depend on a number of factors. And really, the best exercise is the exercise that someone will do. And so that's going to be different for everyone. And that highly depends on how someone's Parkinson's is presenting, very much depends on other factors, particularly what does someone enjoy? What will they keep up with? What's safe for them? What's realistic? What is sustainable to keep going with over the long term? And really, the nice thing about the research findings that are supporting exercise as a management strategy for Parkinson's, the research is really supporting multiple types of exercise are important for people with Parkinson's. And we can break these down a little bit into different categories. And I will just offer, although they're written separately in these different categories, different exercise and activities can kind of span more than one category. But I do want to share with you that the research suggests that aerobic exercise, specifically moderate intensity aerobic activity, is effective for potentially for managing the motor symptoms of Parkinson's. So that's always going to be an element of an exercise program. And there's many modes and ways to make sure this can work effectively for someone. So aerobic exercise is something that increases the heart rate. And so you may feel when you're doing this type of exercise that you're sweating, you feel like you're breathing a little heavier. And so activities such as walking or the exercise bicycle, there's different ways to get this into someone's program. We also have evidence to suggest that strength training, specifically progressive overload training from the major muscle groups, is important. It's a way to potentially improve the slowness that can be associated with Parkinson's and perhaps the stiffness. And that also helps people improve their overall daily function. And again, there's many ways to incorporate strength training into a program. Flexibility training is also something that can be incorporated in a component of someone's exercise program. Again, this also helps combat some of the stiffness that might be associated with people's exercise program, and there's many ways to include flexibility training. And balance training is also a critical piece. Balance training can help related to fall prevention. Balance training can include a number of different activities. And again, this kind of training plan is best if it's personalized to the needs of the individual. I'll also share that the APDA resource, the Active booklet, which was developed from our office, but in conjunction with the APDA, and the resource guide for that is linked, I think, in the information in this session. That booklet has detailed recommendations on these different styles of exercise that I know we've talked about, and to try to give some suggestions on ways to incorporate. But again, working with a physical therapist to design an individualized exercise program that works for a person is really the best way to incorporate these exercise guidelines. Another question that we often get in our center, coming oftentimes from family members, is what can a care partner do to support someone with Parkinson, especially regarding their safe movement at home? Well, there's really a lot a care partner can do. They can really play such a key role in safety at home. And some of the elements that they can provide is really teamwork, coordination, communication with the person experiencing Parkinson, because this care partner is probably someone that knows the person with Parkinson's the best, knows the home routine, knows what works in the house. Some care partners are able to provide coordination as it relates to medication. Sometimes that also gives them a very unique insight into the role of medication and how it affects the person with Parkinson, recognizing that sometimes there's times in the day where the medication is working very well. That might be a time where the person has more energy, recognizing that the person may have some off times or times where medication is kind of wearing down, and that care partner may see the effects of the person with Parkinson in those times in the day as well. A care partner can also be someone that can be on board potentially with an exercise plan. Sometimes it's motivating to be able to exercise together, go for a walk together, stay active together. And the care partner really is maybe one of the best ones to provide some motivation and kind of assistance in that regard. Again, the care partner is probably very well versed in what the daily schedule is, what the routine is, what's going to work for the person with Parkinson. Care partner can also be such an assist when it comes to potentially coaching movement with different cues, recognizing that some clear, calm, very specific directions can really help someone who might be struggling to move or get around the house. But on this topic, care partner can also provide some very sort of key support when it comes to, say, the physical environment at home. And by this, what I mean is kind of ensuring that if moving around the house is a challenge, sometimes making sure that the space is wide enough, that there's maybe not clutter, that there's good lighting. Say, someone has to get to the bathroom in the middle of the night and that's difficult, that the path and that the lighting source is going to be favorable for the person with Parkinson. So care partner really can have quite a prominent role in supporting the person with Parkinson on many different levels. And that kind of brings me to maybe one of the latter questions that we would want to share with the audience here is that there are some questions that a physical therapist might ask you. And of course, this would be in the context of working together in physical therapy. But very specifically, at that first physical therapy appointment, it's very important for us to understand how could physical therapy help you in your daily life? What's important to you? What is it that you want to be able to accomplish, to improve? Is it travel? Is it time with the kids? Because that's really going to help shape what the exercise and the physical therapy program would look like for you. Again, it's important for physical therapists would want to know for you personally, what Parkinson's symptoms are you experiencing and how they're affecting your daily routine? In terms of exercise, where have you had success in the past? What have you enjoyed? And what helps you, participate in physical therapy? I think you know yourself more than anyone, and you know what's going to work for you, but that's exactly what a physical therapist would also want to know. So to that extent, we feel it's important for everyone to feel that they can connect with a physical therapist in their area. For some people that may have not seen a physical therapist yet, or potentially might not know where to go, what kind of physical therapist should I see? These are just a couple of options. Often, your neurologist is very connected with the physical therapist in your area, so that office may have some excellent suggestions. The APDA is a national organization, but has a chapter in every state. So your state APDA chapter may again be well connected with physical therapists who understand Parkinson's in your area. So that can be an excellent resource. We have an exercise helpline here at Boston University. I have a slide coming about that in just a moment. So we have a resource that we'd love to be able to help connect people with physical therapists in your area. But there's two other additional resources you might see on the screen. These are from the American Physical Therapy Association. One is kind of a generalized list of physical therapists in your area. Clicking that link, you want to be clear that the section of physical therapy you're looking for is neurology as a specialty. And then this latter link down here is among the American Physical Therapy Association. There's a specialized section of physical therapists that work specifically with degenerative diseases, including Parkinson's. So this is another link of that might be able to connect you with physical therapists in your area who understand Parkinson's and who would be great to work with. But on that note, here at Boston University, of course, we're here in Boston, but through support of APDA, we're really here for everyone across the country. We have a toll-free phone number, you see the number here, and an email, rehab@bu.edu, where we'd love to answer questions about exercise for people with Parkinson's, including potentially connecting you or helping you find a physical therapist in your area who understands Parkinson's. So this is always a resource and we love it if you are in touch. So, having said all that, I think what we'd love to do is bring Sarah back on to kind of take questions from the audience, maybe talk through some more information for today, and really just share with each other.
Thank you so much, Teresa. That was wonderful. And I can tell just having listened to that and seen some of the questions ahead of time, you answered a lot of our questions off the bat. So thank you so much. We are going to include a few questions from the chat today and also some that we got ahead of time. So I'll start us off with one that was asking about the difference between home physical therapy and outpatient physical therapy and how to decide what's right for you.
What a great question. Thank you so much to everyone for that. So home-based physical therapy is a physical therapist that comes to the person in their home environment and works with them there. And that can be quite effective, as you can imagine. Say if the person's having difficulty getting around, say, the hallway into the bathroom, what better place to work on it than that hallway and that bathroom? And really work on the strategies that are realistic, that would work with the person's environment. So that can really be quite helpful. That type of physical therapy requires a referral, as often physical therapy does. But then that would connect you with a physical therapist that would come right to you. Outpatient physical therapy is a clinic similar to where Sarah and I work, where a person is coming into a clinic for an appointment. And so that type of physical therapy sometimes may have access to different, a clinic, different environment, but sometimes access to different equipment. And that type of physical therapy is often recommended for people who are a little easier able to get out of the house and come to the clinic. So both can be quite effective depending on what a person needs.
Thank you. I think the next set of questions we got, and I'm going to apologize up front here, we can't fully answer this, but people did have a lot of questions about insurance coverage for physical therapy, which we know unfortunately can sometimes be a barrier or can be hard to navigate. So just to say we can't answer questions on specific types of insurance, but I think along those lines, Teresa, if you want to talk a little bit about if insurance is a limitation, someone only has a certain number of visits a year, or for some of the questions we got, it sounded like people were hoping to continue PT in more of an ongoing way, but insurance was sometimes a barrier for that. So if you have thoughts or things to share on that, that would be great.
Thank you, Sarah. I appreciate that. I appreciate everyone's question because that is something we deal with quite a bit. I think one thing that is helpful is when you do meet with a physical therapist for that first examination, to really talk through with that physical therapist, given your particular insurance coverage plan, kind of if any limitations seem to exist, what they are, to kind of get your physical therapist sort of input in terms of how long the course of the physical therapy, meaning appointments are more regular, how long that would be. It might not be something they can answer immediately on the first visit, but after working with someone, I'll kind of get an idea of maybe how long this will go and really what the goals are of the course of care will kind of drive that. But having said that, physical therapy, in particular outpatient physical therapy, is episodic. So it will kind of run where the episodes, the visits are frequent, working together on a goal. But almost always, one of the major goals is how to help someone with Parkinson's continue on with their exercise and their activity and their safe movement when physical therapy comes to a discharge, which will happen. So that will be part of the goal. And I know you could see from that one picture we were showing is that when that round of physical therapy ends, that kind of the intent is really the person's able to keep up with their exercises, keep up with the class, and that might need some creative solutions on ways to do that. What's going to make a person sort of keep connected with exercise? But the idea is that that would go on for a period of time. And then the person might return to physical therapy again for that new evaluation to check in a little bit to check kind of on some progress. And given measurements that were taken at the last round of physical therapy, you can kind of start to see a trend of how someone's doing. That might again turn into an episode of physical therapy, but then that will come to an end. And I think you could see on and on. I think what we really advocate for is following someone with Parkinson's kind of longitudinally in the long term, but yet saying that that doesn't mean that physical therapy would always be continuous. That really probably won't be the way it will go. But however, to get back to the original point, I think discussing with your physical therapist kind of early on in your course of care, what insurance coverage barriers or what insurance coverage exists, and then kind of working together to determine how long round of physical therapy will last.
Thank you. Yeah, I agree. I think the more upfront everyone can be, and also, hearing your physical therapist out about what their decision making is, about how long physical therapy might be helpful, having those conversations early and often is really helpful. Sort of going off of that, we got a few questions related to those interim times. So if you have, a few months in between your physical therapy evaluations, those times where you're exercising on your own, going to a class, we had questions about how to stay motivated, how to work against some barriers that you might experience. Fatigue came up from several people, that it's hard to stay motivated and stay active in those in-between times. So Teresa, if you have any tips or ideas related to that, that would be great.
Absolutely. And I'm so glad someone is bringing up the idea about fatigue because that is something that people have, often report that they're dealing with. So in terms of, say, staying motivated, may come back to kind of as an individual, you know yourself. Um, what what are some things that help you stay with plans or programs in the long term? I'll just give a couple of suggestions. For some people, they know if they are attending a class and there's a time and a place and they they want to be there, they will be there. There's almost no question about it. For some people, the idea of just getting in the right exercise outfit or just getting in the car driving somewhere, that already seems like layer after layer of things that are difficult to do. So for someone like that, having an exercise program that could easily be done at the house kind of eliminates, getting in the right jacket, getting in the car, driving, parking, to kind of know what things sometimes are almost like a stopping point for you, and then trying to work with that, not against it, trying to work with that. For some people, they've joined say a class at a local YMCA that's intended for people with Parkinson's. Sometimes they end up finding kind of a community bond of other people that they know who are experiencing Parkinson's to an extent, and that's kind of motivating to join that class every week to see the friends or the people you've come to know. For other people, they're very, very committed to the number of steps that they get on their watch. They want those circles to close. If that kind of thing with data and information and tracking suits you, perfect. That's one way to kind of keep up with it. But I think maybe in the bigger sense, we know that exercise is essential for people with Parkinson. It's one way the research is suggesting that may slow down the say the progression of Parkinson's. So kind of acknowledging that as the big picture and then trying to figure out how that could work the best for you, keeping an open mind, because it might be some trial and error. But again, this is exactly something a physical therapist would want to work with you of how to keep things going when you're not regularly in physical therapy.
Yeah, I think just emphasizing that as physical therapists, it's not just the what for us, but the how, right? How is this going to work for you? And addressing that during your course of physical therapy rather than realizing it, 2 weeks after you finish can be really helpful. I love when patients come in and say, I'm going to be honest, I didn't do this week. And that
Yeah.
opens up a whole conversation. So really being honest with your physical therapist, sharing some of these barriers like fatigue so they can help you individually problem solve, I think can't be overstated. Um, we're going to change topics a little bit here. We had a nice question in the chat from someone named Doug. Sounds like Doug is a really big exerciser. Keep it up, Doug. We love to hear that. But he's wondering, he exercises 5 days a week. He's been on a consistent program. Does he still need to go to physical therapy? What do you think?
Yeah, Doug, I appreciate again, excellent with continuing with the exercise, but I would say yes. I would say this is a perfect time to connect with a physical therapist, have that evaluation. There's a number of different data points that we can collect to try to understand your movement and to keep some of these metrics on you. And it could be that that's maybe a single appointment to get some of this testing so the physical therapists have it, to give you a chance to ask a physical therapist some of these questions that might come up. Is it possible that there's maybe one or two areas of your exercise program that could maybe use some support? Maybe. And then if it's the kind of thing where it's not necessary to develop a longer course of physical therapy, perfect. stay continuous with what you're doing, but maybe come back to that physical therapist next year and have an evaluation. We will be able to kind of track some information and maybe start to pick up very small changes in some of that data before it shows up in a bigger way in life. So my answer would be emphatically yes.
I agree. I think sometimes that's why we call this the dental model, right? Like some of us brush our teeth twice a day, we floss, but we still go to the dentist twice a year. So if you're on your exercise program, you're feeling good, still come to physical therapy. We'll hopefully be a little bit of your cheerleader. And it doesn't mean we have to give you new exercises. Sometimes it'll be like, let's make sure, you're doing this class 3 days a week. Let's make sure your balance is challenged enough, or you have options for how to do certain movements within what you're already doing. It doesn't mean you have to do more because you come in.
Absolutely.
Um, we had a little bit of a question related to maybe some back pain, and I thought it was a good prompt for us to just talk a little bit about when pain might be a reason to see a physical therapist.
Sarah, that's an excellent point. Thank you for anyone bringing that up. People with Parkinson, yes, I think pain is sometimes a very prominent and potentially sometimes underlooked symptom that people with Parkinson's are experiencing. Sometimes pain is the barrier to participating in movement, walking, exercise. So that in and of itself should be addressed. And sometimes a course of physical therapy might be dedicated into solutions or suggestions to try to manage that pain so the person can move better. So that is definitely a reason to connect with a physical therapist to try to manage that. And that's just really going to hopefully benefit sort of all function and all movement for someone with Parkinson.
Perfect. I wish we had more time, but we're going to start wrapping up here. I know there's a lot of questions, and if you sent questions in today or ahead of time, we did save them, so we'll be looking at them for inspiration for future sessions. You may have noticed if you sent in a question about balance, we did not answer it in our chat here today because our next scheduled programming will be April 7th. That's the first Tuesday in April, and that will be Balance 101, Understanding Unsteadiness. So learning a little bit more about balance in Parkinson's disease. So we really hope you'll join us for that. You can go back and listen to other Let's Keep Moving recordings that we've done in the past. If you subscribe on YouTube, or if you just go on our APDA YouTube channel, you can see previous topics and look forward to new ones. But overall, I just want to give a big thank you to Teresa for sharing all of this information. And thank you so much to everyone who came and joined us today and participated. It's so nice to see you in the chat and hear from you and be part of this community. So thank you.
Thank you so much, everyone. See you next time.
Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity.